So the purpose of this technique is when picking up tiny things off the floor, like a golf ball, or taking them out of a bin. This approach is highly helpful in preventing back injuries. Use the golfer's lift to easily pick up tiny objects from the ground. Knees are not bent when using this method. So instructions of how to do it. So on the side of being supported, flex your hips forward while extending your arm and leg on the side not being supported. So pick up the item with a secure but firm grip. Keep the knee of the foot that is being supported slightly bent as you lift the item and bring it near to your body, resuming your stride position. This technique is when picking up tiny things off the floor, like a golf ball, or taking them out of a bin. This approach is highly helpful in preventing back injuries. Use the golfer's lift to easily pick up tiny objects from the ground. Knees are not bent when using this method. So the purpose of power lift technique. So for items that are too heavy for you to straddle, use a power lift. So the basic lift and this lift are extremely similar. Your center of gravity is shifted during the power lift by the item. So therefore, you have to push your buttocks out to make it up for it. So usually, professional weightlifters use this position while they lift. So the instructions of how to perform a power lift is to pull something with a power lift, grab it firmly and step into a wide stance with one foot to the side of the thing you're pulling and the other foot somewhat behind you. So then to start a strong forceful pull, flex your knees and lower your back. So the learnings of this technique is power lift assists you to strengthen almost all of your body's muscles. Strengthening your legs, back, and upper body muscles in particular is beneficial. So the major reason for making every effort to lift with perfect form is for this precise reason. So your body may go out of alignment while you carry large objects, which might put your muscles, joints, and tendons at dangers of tearing or straining.
Bed positioning is an important part of patient's care plan. Proper bed positioning can help prevent pressure ulcer, improve circulation, reduce the risk of falls, and make easier to perform nursing care tasks. It is important to consider the patient's individual needs. When positioning a bed, it is essential to use the correct techniques when positioning a bed to ensure the patient's safety and comfort. It's also important to ensure that the patient's position in a way that comfortable and will be interfere with used nursing tasks. Types of body positioning, and the first one is the prone position. This is the when the body is lying face down. It's commonly used during the medical procedures such as X-rays and during physical therapy. And the second one is supine position, when the body is lying face up. It is the often used medical procedures such as ultrasounds or during relaxations. Third one is sitting position, and the body sitting upright is commonly used for everyday activities such as eating, working, and reading.
These are the guidelines needed. First is to introduce yourself. Hello, I am Blanco and I will be your PTOT for today. Then, inform the patient of the planned treatment. Then after that, describe the position for this treatment. For this treatment, we will need you to be in a prone position or nakadapa. Then, indicate which clothing to remove and provide temporary clothing. After that, make sure that there are enough pillows or equipment for the position. In this, we will need 3 or 4 pillows and a towel. Then, provide storage for the patient's personal belongings that we may not require for the treatment. And then lastly, assist the patient in his or her breathing and positioning. Precaution. This position is not well tolerated for 2 hours for all the adults. A change at 30 minutes often will need to be made. In addition, this position is not appropriate for persons with breathing problems.
We will now demonstrate the prone position. First, you need at least 4 pillows and a towel. The first pillow should be on the patient's feet, 1 on the thighs, then the third on the lower abdomen of the patient, and lastly, 1 pillow on the head.
Precaution. The pillow behind the knees will encourage hip and knee flexion and may contribute to lower extremity contractures, but this position shall not be maintained for prolonged periods of time.
We will now demonstrate supine position. First, you will need 2 pillows and 3 towels. The first pillow should be on the legs to relieve pressure. Then place 2 towel rolls on either sides to support legs in neutral rotation. And lastly, a pillow on the head.
One method for maximizing patient comfort and dignity while minimizing tissue damage is draping. Avoiding excessive, protracted pressure on circulatory, neurological, and soft tissue structures is one of its precautions. Positioning patients who are comatose, young or old, incapacitated, or simply lack normal circulation or sensory perception should be done with extra caution. It is intended to provide the patient modesty and support healthy body temperature regulation.
Hi, my name is CABALLERO. I'll be your physical therapist for today. Today I'll be draping you in a supine position. May I have your consent?
Yes.
Alright, if you have any discomfort, just tell me. Alright. So first you can lay your head down on that pillow. Alright. So this will relieve any this will help avoid excessive cervical flexion or upper back flexion or abduction. And then I'll be placing this pillow on your proximal spaces. Alright, so here we go. Is that alright?
Yes.
Now, this will help relieve pressure caused by overdoses and comfort. So just have your shoulders parallel to your hips. Alright, are you comfortable?
Yes.
Alright, now I'll begin draping. Alright, when you please raise your arms with me. Alright, just raise them down. This is to expose your arm, upper extremities, or in case it needs some treatment. Alright, are you not too hot, not too cold? Alright, okay, here. And in case you need to, if you are being treated for anything lower extremity, I can expose your lower extremities here above the knees.